snapshot, the key, the key lessons which you have been able to discuss. So let's say Alice.
Hello.
Hello.
I invite Mary. She was doing the rapporteuring.
Okay, Mary Kamau, yes.
Yeah, thank you. Thank you, my chair. Actually, you had really summarized the issues that we discussed in the group. And we found that most of the countries, just 1 minute. We found that the extension policies are there. Hello, can you hear me?
Yes.
Yeah, we found that. Hello?
Yes, you too.
Leah, you can be able to mute. Leah,
Can you hear me?
Yes, we can. But let's mute all of us.
But there is somebody who is talking in the background.
Oh.
Is Leah, boy, you mute, please.
Muting me, I don't know who it is.
Okay, continue, Mary.
Yeah. There is some.
I think
Kenneth, can you mute the people who are not speaking, the host?
That we shared with you towards the end.
Kenneth, you can mute Leah Boyd.
Livelihoods na ID numbers. Yeah, the PowerPoint presentation towards the end.
All right.
Yeah, on the.
Kenneth, can you mute? Kenneth. Can you mute Leah?
No.
Okay, yeah, let's go on. Mary is muted now. Sorry about that.
Yeah, I was saying in our group, we found that the national agriculture extension policies are there for different countries like Kenya, like Uganda. Also, Max gave us a list of some of the other countries like Liberia, South Sudan, DRC, Ghana, and I think even Nigeria also they have. So we can see most of the countries have come up with the policies. The issue now is the implementation. All these policies, they are at different levels of implementation. And it's for the countries to see how they can bring on board the issue of nutrition in some of these, in the implementation of the policies. We also found that there are various strategies for different countries. Like Uganda, they told us they have strategies for research. We also have in Kenya, like in the Vision 2030, we have the issues of nutrition. So all in all, we can say that there is something going on in different countries as far as the nutrition focus is. And we do pray that they will be able to implement and bring on board all other players who are in the, who are also doing the same thing. We also found that there are linkages. The question number 2 was on the linkages. We found that the issue of nutrition cuts across so many ministries, so many organizations. And we found that especially the Ministry of Health has maybe a section which deals mainly on the issue of nutrition, and also in the Ministries of Agriculture. And we say that we should be able to harmonize whatever is happening so that we can be able to move as one. For everybody who is doing something on nutrition, we collaborate together. On the issue of audit and monitoring, on the at the implementation level, we found that in some countries, maybe there is some focus on the training, even at the primary level and schools, about the issue of nutrition, to calculate the same in our children as they grow. And then we found the issue on the challenges of implementation of these policies. One of them is the finances. We found that generally agriculture and extension for that matter is slowly funded in most of the countries. And you'll find that most of these programs are funded by donors, and the issue of sustainability becomes a problem. If we have maybe like a program that is on and there's no more funding, sustainability becomes a problem. And this goes even at the institution levels and even other providers. The other issue we found on the challenges is that we do have some countries which have emphasis and have programs which are already focusing on the issue of fortification, food fortification, but not all of them, and it's being done also at the low level. And in Kenya, I mentioned that we have even promotion of high value crops. We used to call them orphan crops, but you find that they are better nutrition, they have a better nutrition capacity, and they are being promoted. We do know that there is also challenges on the ongoing issues like the COVID, like the climate change. We do find that these are some of the issues that are actually affecting what we have already put in place, even in policies, to be able to implement on the issue of nutrition for most of the countries and the world at large. So I think those are the main issues that we actually discussed. Thank you very much.
Thank you very much, Mary. We are actually clapping for you. It's only that with this virtual orientation, it's right. Thank you very much. I think you have brought back a number of issues, and I'm sure you have the comprehensive report, which of course your chair will be able to share with the chair, so that we can be able to put it together. So let me invite the second one, the group of Professor Maina. That was on organizational. Professor, who was your rapporteur? You can invite your rapporteur.
Peter, let me say we got a bit disoriented at the beginning because I was supposed to be in another room, but we did very well. I want to very much appreciate the input and the insight we have received from our members. So we looked at organizational capacity issues, and we had really, I just wished we had an hour or more time to discuss. Many issues came up very well. So of course, we wanted to see whether there are organizations with the right mandates and the right capacities, any good practices. Of course, one of the things we have learned is when looking at the issue of nutrition, where do we start? And the point made is we have to start somewhere a little bit further down the road, not just when food has been produced or these technologies are there and being brought to the farmers. The point of, for example, addressing soil conditions. When soil is poor or polluted, that has an impact on nutrition. And so when looking even at organizations to work with, we need them to reach right to those who have to do things with technologies or practices that influence the soil. So giving that as an example. Another very important thing that came up is the baseline, the information that we're using to measure performance. So when we ask ourselves the question whether organizations have capacities, against what are we measuring their performance? So we need to have parameters, good parameters for measuring where we are starting and the progress that we are making. And that would even go when we are assessing the capacities of institutions. We had a very good information coming from Uganda, more or less, the initiatives they are doing, and there's quite a lot happening there. They are good organizations with many different mandates. But a very important point was made that initially, or sometimes back, the issue of nutrition was mainly handled in the Ministry of Health, and it tended to focus more on women or the mothers. And this point, which I see that Beatrice addressed it in the chat, linking nutrition to gender, that if only you are speaking about nutrition to women and men are not involved, you cannot make progress. which now comes to what institutions are we working with? Do we have, because this is not only a science issue, it's also a social science matter, not necessarily a biological science issue, to involve all gender equally, because they have different roles and capacities they bring on the table. Very, very important. So one of the things, of course, I learned is there can be organizations with mandates on nutrition, but are they the right organizations? Do we have all the relevant organizations included on the table? Those are some of the questions that seem to arise from this discussion. Another point we learned from Cameroon is, for example, some of the initiatives to contribute to capacity development. So, for example, there is a module, a training module that has been developed so that those who now go through training in extension services also get some training on nutrition, which goes to see into what organizations are doing. And of course, through the canvas, there are other initiatives to look at this. Another point is, for example, how organizations obtain information, and particularly the role of private sector. We did ask this question. Are we having more public or more private sector, or do we have a good balance or a mix of both? And clearly it comes out, there are private sector actors who are involved in this space. The issue of where do they obtain information on nutrition from? A very good case was given here. There are many organizations that are availing this information. Happy, Sopo, BioVision, and others. They are availing this information, and through partnerships with the private sector, the ones who are able or involved in this area, for example, the ICAO platform, they're able to access that information, adapt it and repackage it to suit the interests of the consumers of that information and the channels they use. Some of it either through SMS or WhatsApp and such other things. So we did see, and the good thing we learned is there is no cost. When a partnership is well structured, the information can be accessed without cost, and there is value added to everyone. The issue of what kind of organizations are we looking at? The balance between whether they need to be scientists or they should be having other specializations came out clearly, and we know we need the diversity in terms of skills, knowledge, and the things that people can do. We were given a good case in Kenya. The organization managing the ICAO is launching an initiative called the Border Soil Advocacy Program. Border are the people who ride motorcycles here in Kenya. And so there's an initiative to work with them when they are not engaged in their normal, bicycle transport work. They can be involved more in agriculture. And we did ask the question, does that avail an opportunity also to, promote issues of nutrition? And yes, there is. We were given the example that the model uses a +1. The border himself is a man, but they are required to work with another one, and the other one is a female in their household. They could be their mothers or sisters, wives, and that also now is helping to bring more people on the table. Before I finish, let me say we touched on the issue of collaboration and the leakages between sectors or organizations in different sectors. And clearly, there are organizations that are doing things and there are other organizations that are not doing what they ought to be doing. And these are affecting nutrition. Very, very important. We did ask the question, do we have these multi-sector kind of coordinations and collaborations? Yes, we do have, but in other cases we don't have. A good example was given. To effectively apply extension and advisory services using digital platforms, you need the telecommunications companies on the table. Unfortunately, it is not easy to bring them on the table. And we ask the question, is it that they are not seeing value, or we are not attracting them adequately? How do we make sure we can bring these diverse organizations on the table? There is so much that we have talked about in this session. It was said that nutrition, addressing the issues of nutrition, should not be reactive when things have gone bad. It should be proactive. It should address even to those who are already in good health. Don't go to those who are in emergencies. Be proactive, target everyone right now. And we learned many things, Peter. I couldn't really summarize all of them in these few minutes. Thank you very much.
Thank you very much, Professor. Quite a lot of things. I'm sure we are going to have the report, and I'm sure we're going to be able to put it in perspective. So let's have the last group. I was the chair of that group, and I had a rapporteur, Pauline. Pauline, you are invited to give us a summary, just a summary of what we have been able to discuss. Pauline?
Okay, thank you very much, Chair. And this is a summary for Group 3, which was discussing on practice of NSA at the grassroots level. And our first question was whether the practitioners have the necessary knowledge. And the answer we got here, it is yes and no, because for some, the practitioners are already trained nutritionists, especially those who have done training in home economics. But for most of the other extension officers, mostly they just did a small course on nutrition, which they may not be able to apply in practice. So the answer was both yes and no. Then in terms of improving, whether there's an opportunity to improve their capacity, we said that the opportunity is available, but what is important is to first ensure that there's a training needs assessment that is done, and the extension staff can go for refresher courses just to increase their knowledge on nutrition. And we're told that in Nigeria, this is actually being done very well because they have trainings at the village level from the training institutions. Then for our second question, we're looking at to what extent do practitioners integrate nutrition in extension services? And here the discussion, we saw that it is average because it depends on different organizations. And we saw that both private and public university organizations are involved. So what we said is that, yes, they're involved or they practice, they integrate nutrition in the extension services, but it needs to be done in a more structured manner. So currently it's just adding in some little information here and there, but it's not really planned for as such. Then our third question was the sources of information on nutrition. And again, here we said it varies depending on organizations, depending on individuals, but mostly we said it's from journals, from the media, and also some organizations, they plan trainings for their staff. In terms of the organizations that provide information, of course, we have the Ministry of Health, mostly the Department of Nutrition. In some areas, also the Ministry of Agriculture, some nutrition-based NGOs, then universities and research institutions. In some places, there are schools, Ministry of Education, and also the local government. Then the next one. So these organizations, they collaborate, but I think it was clear that the collaboration is not very structured and is not really formal. So this is something that we need to be done. Then the fourth one was the good practices that have been integrated. So some of the good practices that we saw were one, school gardens, so establishing school gardens so as to train the pupils when they're still in primary school to get that, to know the importance of nutrition in a way that they can also take this information back to their parents. Then we saw there's also training on feeding practices. This was especially came from the Ministry of Health. When maybe children go to the hospitals, the parents are referred to the extension to be trained on more on how to grow better crops. Then of course the home gardens, then also cooking to ensure that we don't lose the nutrients as we prepare our food. And then school feeding programs for some schools also as a practice of integrating nutrition. Then the next one was on the challenges that I encountered in integrating nutrition. One, I think this has been mentioned also by some of the other groups, is the inadequacy in coordinating the concepts that cuts across sectors. We've seen that nutrition cuts across several sectors, but the different players have not been really able to work together to give the same information or to give it in a structured way. Then finances is also a challenge. Then human resource, not enough people trained in nutrition issues. Then the capacity to access the nutrition information. This is also a challenge. The information may be there as we've seen, but having access or knowing that the information is there, that has also been a challenge. Then the education system, this also came out as a challenge in terms of policy implementation, because we see that with the increasing population, there are so many schools, and many schools now are in locations where they cannot be able to have gardens. So this again has affected the nutrition, integrating nutrition information. Then the other challenge is the replacing of indigenous foods with exotic foods. I think this is common in many of our African countries. we find that the extension service, most of what they're training on in terms of production is not on the indigenous vegetables, which we know are very nutritious. And I think this goes with what we call the consumer patterns, which have changed very much. There's been a mindset change on people don't want to eat the indigenous foods. So again, this has been a challenge. And also little research has been done on the indigenous foods. Then the other challenge is that most of the nutrition-based trainings or activities are project-based. And this, I think, leads to the issue of sustainability. So once the project ends, then the nutrition activities are no longer there. Then in terms of the recommendations that can be used to improve, one is to encourage farmers to look after their food or to keep their food well. That is the post-harvest management. Then two, we look at processing and value addition, which can help to prolong the life of the food. Then enhanced capacity of the players in the sector, the farmers, the extension staff, and all other the organizations and policymakers on the importance of nutrition. Then support staff to keep upgrading their knowledge because the knowledge is available. Taking advantage of the knowledge that is available in journals, in books, in the media. And I think from our Uganda colleagues, they told us they have a Uganda nutrition manual. And I think in the chat, we got a link to the document, so maybe we can download it and see. And then also the issue of adding the element of gender. This can help because again, like we had, it's important to involve everybody because the decision making, you know, where it comes from. So it's important that everybody is aware of these nutrition issues. Yeah, so that's it for group 3. Thank you.
Thank you very much, Pauline. So thank you very much. I think that one wraps up what we have been able to discuss. And I think at this point, I didn't want to thank everybody because of course I will not have another opportunity within this forum. I would want to invite Professor to give us very quick way forward, and then from there, we could be able to invite Max to finalize for us. So Prof.
Okay, thank you very much, Peter. I hope everyone can hear me. I want to join you also in appreciating what we have been able to do. We've listened to the presentations in plenary on the issue of nutrition and its linkage to agriculture. We've listened to the GCNA methodology and how it has been applied in Malawi and Cote d'Ivoire. And really very good lessons learned. I think those who will come now after what has been done in Malawi and Cote d'Ivoire and the other countries, certainly very good lessons are there to build on. Hopefully we go on to improve how we are doing things in our own countries. I think also very important things have come out from the 3 breakout sessions. Really, really very good, and I'm appreciative, and I hope everyone else is. If time was allowing, we would have had more deliberations, but we've learned that indeed policies are there on extension, there are policies on nutrition, but there are issues on their implementation. There are challenges, but we need also to appreciate the effort that has been made and the progress that has been achieved. So today we do have at least a document that we can go on with, and the issues that have been identified. We know where to start looking as we address to improve the linkage between extension and nutrition. So with regard to organizations, I think it's also clear, and I think to me, today we can say our eyes are open to many more issues than we would have thought of when coming to this meeting. That when looking at organizations, we have to be broader, more open-minded to see the diversity of the recognizable, the visible actors, and possibly others who are there doing important things, but not very visible, not very vocal, not very noticeable, but nevertheless very important, and make sure everyone is included as we move forward, and whatever capacities they can bring on the table, to pull forward together. There has been some very important things, learned regarding the practice, at the grassroots level, where there are very many good practices that have been mentioned, using schools, the home gardening, working with hospitals, very many good practices. And I would like to say that much has been learned. We will look forward to receiving the reports from the different teams, putting them together and compiling a report that we can also share with our stakeholders as we go forward with this discussion. I know, Peter, we do anticipate we'll be reaching out to some of the participants to get more information to inform this ongoing exercise or activity to understand where our capacity gaps are in our different countries and see what we can do to improve integration of nutrition into extension and advisory services. I want to thank you very much, Peter, and join you in appreciating everyone for your inputs. And I hand it back to you. Thank you.
Thank you very much, Professor, for a good summary. As Professor said, we will now be reaching out to you with in-depth questionnaire to be able to really understand the status within the Pan-African region in relation to this very important area about nutrition. So with this, I would like to invite Max to be able to guide us and to officially guide the closing. So, Max.
Thank you, Peter. Thank you. Thanks, everyone, for this very lively session that we've had. We can't thank you enough because you've been very intelligent. And I want to say thank you. Before I put a last thing, I would like to request Dr. Slim to use my computer and say 1 or 2 words.
Yeah, Peter, thanks a lot, and the FAO team and all those who presented, my former chair, Mary Kamau, and all of you. It's really greatly appreciated, and I think what we can do and work out on a rollout plan of this initiative, and we see how we can implement it, especially in context with what AFAS is doing. And certainly we have seen what has worked in Kenya, and we can try to duplicate it if we work together. So thank you very much.
So with that now, I want to say thank you. And if you wish to put your video on so that we take the last photo by Sylvia and Kenneth, we now need your last photo. Beatrice, thank you very much. Mama Mary, we thank the West Africans. We also thank the people from India. You know, it is now late there, but we can still say. But as the photos come, let me request Anne, our sponsor for this important LOA with the FAO, to say 1 or 2 words as a closing remark so that you see everybody's faces here. So Anne, you are most welcome to say a word as we wind up this webinar. So from my side, asante sana.
Thank you. Thank you all for being here. I am apologies for not having joined earlier. I had my calendar for tomorrow, but thank you so much. I appreciate all the enthusiasm and work that you are going to be putting into this project, and we hope that this will bring excellent results. Thank you, everyone.
Thank you.
Thank you.
Okay.
I can't appear.
All right. Thank you then. Goodbye.
Bye.
Bye. Goodbye.
Max, has the picture been taken?
Bye.
Bye.
Mine
Anyone
was
took the
disabled.
picture?
Mine was disabled by the host. My picture.
Done. It was taken. Doctor is saying something. Professor is saying something. Okay, bye.
Bye. Go ahead.
Bye.
Bye. Bye, Daphne.
Let me sit down. I'll check it myself. See, mommy.
Yes. Bye, everybody.
Hey.
Bye.
Well.
Bye.